when trying to find more agents to look at their different markets as well? How do you think that differs?
Well, it's more internally for sure. When
Yeah.
it comes to agents, majority of the agents are, I would say, over 30, most of them.
Mm,
Because it also, for you to become an agent and create your own book of
yeah.
business, it requires a lot of trust and building
Yeah.
that relationship because
Mhm.
your clients are all going to be families. And it's
Mhm.
an important aspect of anyone's lives, anyone's families. So you want to work with an agent that you trust, right? So I think in that regards, that's why our agents are mostly over 30 because they had to take their time and build a relationship.
Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo, and my guest here today is Catherine Okubo, who is a CEO at MPB Health. Catherine, thank you so much for being here today.
Thank you for having me.
I'm excited to have this conversation because you are now the third or fourth Brazilian fellow fellow person that also is an entrepreneur in North America that I'm speaking with. So why don't you tell everyone a little bit more about MPB, a little bit more about yourself, who you guys help, what you do, and any context you'd like to share about the company as well.
Yes, of course. I'm really happy to see other Brazilians too in business. And it's really interesting because MPB Health, it's really completely different than I ever seen in the world. And I've joined MPB about 2 years ago. And when I started to realize how much this revolutionizes healthcare, I said, oh my God, we got to bring this to Brazilians in the United States. So to give you more details to make sense, we are an alternative to health insurance, to the traditional health insurance. It's comes from the model of health sharing, which I like to give the example of like Uber. It's the Uber in healthcare because it's completely changing the healthcare system, just like Uber revolutionized the taxi industry. And it works in a very different model, but it's still very similar to the traditional health insurance, but completely different. And the funny thing is that it's a lot of people don't know about it yet, but it gives a lot more freedom too. So if you are looking, to kind of get away from networks and go to any doctor, this is the plan for you. You can have this membership in Florida, but if you travel, let's say to Texas, you can still use that. And it does not require any type of like social security, or it's not tied to governments, so it does not have to be tied up to subsidies either, subsidies. And this is why, thinking about that, I realized, you know what, we need to create something for the Brazilian community, which is what we did this year. And we launched a membership in the same model for Brazilians in the United States. It's all in Portuguese from beginning to end. It's called Saúde Max, and that's how we are revolutionizing the market both in America with, the US side, which the company has been over 11 years in the market. It was founded by Rod Maxon, who has over 40 years in this industry. And so it has a really good foundation. It's very solid. And me being Brazilian, of course, I came on board and I'm like, we got to do something for Brazilians.
Yeah, of course.
Fair play.
Typical Brazilian for us. Yeah. But that's really, really cool. Thank you for sharing that. I think one of the most valuable things I got from our first conversation before we had the recording is that oftentimes in healthcare, and I would say maybe specific to the US, but yeah, maybe specific to the US, is that we all know the big pharma and really the idea that they're profits or their revenue comes from people staying sick and not, of course, solving their problems. Of course, we could go a completely different rabbit hole for that conversation. But one of the cool things that what you guys mentioned is that the impact that you want to achieve, of course, is it exists, but the business side of things, it is not profiting on people's sickness, it is profiting on people's health. So could you tell me a little bit more about that? I found that really exciting.
Yes, and it's so true. Philosophically, I think it's very important for us to, to be together with groups and support companies that are on the same philosophy or mission as you, with values that you agree upon. And
Mm-hmm.
yes, and as you mentioned very well, most of the traditional, insurance market, that whole healthcare system in the United States, and I think other countries too, they're really not interested in in finding the cure of the problem because they will profit more the more that you are buying more medicine, doing more treatments, etc. And that's
Uh-huh.
the very big differentiator between us is that we are really focusing on people's health. The healthier that they are, the more all of us profit and benefit actually. So that's a
Uh-huh.
very different philosophy from any other healthcare company, and this is why I love what I do. I think it's a true community sense.
Yeah.
And that's why we're really focused on prevention and having people take care of themselves. And that's why our healthcare membership is not it's not for everybody, basically,
Mhm.
because we really want only people who are conscious about their health. If it's somebody that's going to be drinking all the time, doing drugs, we don't want
Yeah.
that plan because it's going to affect the entire community. But if you are a conscious person who takes care of your health, who is
Mhm.
healthy, this is who we want to join our community.
Yeah, who has that intention, but maybe has never found a place to guide that, to have the right direction for their intention and do the right things, the right dieting, the right exercise, etc. And of course, the
Right.
the alternative on the health plans that you mentioned as well. And I would love to hear, how are people usually finding out about these, about you guys, and that this alternative method exists? Because I think so often there's the common notion of, oh yeah, I have to go get the usual insurance and then get myself into debt and then go through all these different things. So how are people coming across MPB and finding out that it is something that they can take advantage of?
Yeah, so we actually work with licensed insurance agents. So that's how most of them do find out about us. We work with over 300 agents all over the country because this type of membership is available in all the states but
Mhm.
Washington states. So this is how they find out mostly is through these agents that we work with. So
Mhm.
anybody that has a health license in the state, they can actually reach out to us and start to offering our memberships. We provide training tools, then we do all the cool stuff with events and trips, free trips, and all of
Mm.
that. So it's cool. It's really good. I love working with the agents.
No, that's really, really awesome. And it's interesting because I would love to hear if, through that relationship that you guys have with the agents that are, of course, ultimately reaching the population, is there any specific way that you see the company engagement or the company growth by using them as partners to, of course, reach more people, find a bigger market that can use and get impacted by the things that you guys are providing? Is there, let me actually rephrase that question. Is there anything that you think you guys do differently to be able to allow the business to keep, of course, achieving the impact, but also achieving that growth that you're looking for, by approaching it in this different way as opposed to direct to the consumer or any other usual business methodologies?
Well, I think that we're already very different as is, right? We're different from
Yes.
most of anything else that's in the market. And as I mentioned, if somebody that has a lot of chronic diseases, they're probably not the best for our plan. But if
Hmm.
somebody's relatively healthy, they don't qualify for the government subsidies. They're
Uh-huh.
definitely going to save a lot more money by going with us. So I
Uh-huh.
think those are the main differentiators, and working with the agents, they know that, right? So they can tell who of their customers will be a good fit and who are not.
Mm.
Um, but outside of that, we really do incentivize them. I think that everything core business-wise is with the agents, so we don't wanna kinda go away from that because
Yeah,
they're who built our business, right? So we wanna respect and honor that. So
of
we
course.
incentivize them a lot. There's a lot
Mm.
of different incentives beyond just monetary, right? Which is the trips I mentioned to you,
Yeah.
awards, events, and that's why I think
Mm.
we are the biggest differentiator. It's in the sense that we really try to build the relationship with the agents in an actual personal level too.
Mm.
For example, we've had a trip this year where we brought our top 5 agents to Hollywood, Florida, to the Margaritaville Resort, and we spent a whole week with them.
Oh, nice.
They it was their vacation,
Mm.
so they were free to do whatever they wanted, but
Yeah.
because we had such a good relationship, they wanted to spend time with us every single day, so we would spend
Mm.
the whole day. We'd go, paddle boarding, go to dinner, get drinks, like, we just had a lot of fun together because it's like a extension of our company, really.
Yeah.
So
Yeah.
so it's really nice. It's really nice to have
That's interesting. Yeah, I think so many business owners that I've spoken with overlook that community side of things, right? Because, as you said, sure, there's the monetary incentive, but people want to look for something. People want to be driven by a mission, and if
that.
you guys and them combining forces and going into the same direction it allows them to achieve that, it becomes really, really awesome. And also, I think there's also healthy competition there. As you said, the top five, I'm sure the other ones that didn't make it were still really striving to make it. And then I'm like, okay, maybe not this year, but next year I'm gonna make sure to
Oh,
be in that
yes. Yeah,
position, right?
and we do multiple contests throughout the year, so it's not just
Mm.
once. So we're gonna get, there's gonna be more, coming for next year, but some of my agents are going within a few weeks to another cruise too that they
Mm.
so
Many things happening all over the time.
yeah,
Oh, really,
it's
really cool.
to be an Asian, so let me just put it that way.
Yeah. And and I'll ask this question as well because it just literally popped into my mind. Um, but I think it's hard to explain the concept of the Brazilian culture to people, and how we are different in just interacting with each other, on a day-to-day basis. Is there any aspect of that that you have taken into the business in the way that you run things?
Oh, definitely. I think Brazilians, and you can probably agree with what I'm about to say. We're very, and I'm trying to say in the right way here, warm.
Yeah,
we're,
no, I think that's a good way of putting it. Very warm, very easily
we're very
extroverted. Yeah.
friendly. We're very personable. We like to interact
Mm,
with each other.
yep.
I think a lot of Brazilians are that way, and especially in business. So one of the things that I've learned, especially when I used to work with family, is that relationships are very important. It's probably one of the most important part of business is the relationships that you build, whether it
Yeah.
is with your clients, with your agents, employees, vendors. That's the most important thing.
Yeah.
And then I take that to here, and I think that is also comes from our culture.
Mm, That's you don't understand how big of a pattern that has been in so many of the conversations I've had. Relationship, trust, that partnership aspect, right?
Mhm.
It's the simplest things when you actually say them out loud, but actually doing them, going through the process, building that relationship, caring about them. It's a completely different. I think it's a different sauce that can happen that can be part of the execution if you actually care about doing these things in a valuable way as opposed to, oh yeah, build a relationship, build trust, whatever that means.
No, yes, and I think people they will really first of all, if you would like to work with somebody that you like, you know, so it's the same goes both ways.
Yeah.
But if you're going to be a professional, you expect those standards too from somebody else. So
Mhm.
it's all that's how you build trust. Is with time, with those interactions, relationships, interactions every
Yeah.
single day.
Agreed. I 100% agree. So Brazilian check mark on that on me for me. I would love to shift the conversation as well, Catherine, on MPB itself, on the company's growth and the goals that you guys have. But also, I think it's very important to speak about some of the obstacles and challenges in the way of achieving goals. So many people always love talking about the successes, and then it makes it sound like everything is sunshines and rainbows.
And
But we
stuff.
know that in business, it's not. Right? So, talk to me about what are some of the challenges, some of the obstacles when it comes to achieving the goals and the targets that you guys have set for the organization?
Well, obviously, the challenges and obstacles, they will change per industry, right? So in my industry, because I'm in a very niche type of situation here, I can't compete for something that is for free, right? So
Mm,
I can't compete with the government paying all these subsidies, and it's basically a person is paying, I don't know, $30 for their health plan. I can't compete with that, right? So that will
mhm,
be one of my top challenges. But it's kind of like it's a very niche situation. Other than that, I would say technology, right?
mm,
Technology based different softwares. That's part of a challenge too because this industry evolves, and as you scale, you kind of have to have a every you got to be ahead of the game,
mm,
and that's part. So we have an IT department. Thankfully, my CTO is it's really great at being ahead of the game.
mhm,
But we definitely had a lot of challenges in the past, like a few years ago, software related, and then finding really good quality talent.
mm,
I think that's a huge one nowadays, especially because the younger generation, although they can be very talented, they want things really quick. Like
Mm,
they are not used to the long-term, um
delayed gratification.
yes, exactly, and I think it has to do, with social media, and you see all of these influencers and you think, "Wow, that's easy," or, "I can have my own business," and great, but you gotta decide what you wanna do.
Yeah.
Because if you're
Mhm.
gonna work for me, you better be working on my business when you're on my time. I
Mm,
don't that's the thing that really bothers me.
mm,
Can have your own thing, but not on, times that you're working for my company because that's unfair. That's not fair, right? It's not fair for me, not fair for yourself either. So
mm,
those are certain things that I find it challenging with the new generation. It's just finding they're really talented, a lot of talent there, but there's that
mhm.
work ethic that I think it's missing. And I don't want to generalize, right? Because I
Of course.
people from every age in my company, from 21 years old up to actually 70s. So it's a big range, and I think the work ethic is just something that I would like to see more of in the younger generation.
Interesting. And do you find that that is only when you're looking at things internally? So, for example, hiring a sales position, a marketing position, a media position, or are you also do you also think that applies to some when trying to find more agents to look at their different markets as well? How do you think that differs?
Well, it's more internally for sure. When
Hmm.
it comes to agents, majority of the agents are, I would say, over 30, most of them.
Mm,
Because it also, for you to become an agent and create your own book of
yeah.
business, it requires a lot of trust and building
Yeah.
that relationship
Hmm.
because your clients are all gonna be families. And it's a
Hmm.
most important thing. Like health is the
Yeah.
most important aspect of anyone's lives, anyone's families. So you wanna work with an agent that you trust, right? So I think in that regards, that's why our agents are mostly over 30 because they had to take their time and build a relationship,
Yeah.
uh, you know?
Interesting. And then is there also an aspect in which, because you mentioned it's all over the United States except for Washington State,
Yeah.
except for that one. Um, is there an aspect of the company in which finding the right agents, the agents who really care and are driving in the same mission, can that also, or is that also something that is sometimes difficult? Like how do we find the right person? How do we make sure that these agents are looking at us and not anyone else for these types of opportunities as well?
Well, I think that it all comes to the experience that they have with us.
Mm.
In terms of finding, it's honestly, our agents, a lot of them come to us.
Oh, got it.
You come to us because we are that alternative, right? And they don't wanna obviously lose that client. They wanna be able to share, "Oh, hey, this is something that you could benefit from."
Uh-huh.
But in terms of retention, is because after working with us, they realize, "Well, this is a really great value, kind of
Mhm.
quality product," and we have the concierge team, which is an in-house, basically customer service team, but beyond that, it's a true concierge where they take care of the customer's needs. Anything
Mhm.
you can imagine, even booking doctor appointments. So
Wow.
it's a really good service for the agent because usually the client would be calling the agent for, questions about the plan or different situations.
Mhm.
They don't have to call the agent anymore. They can just call my concierge team. So
Yeah.
the agents really appreciate that.
Yeah, and I think I recall you were mentioning as well that excuse me, that comes it from beginning to end is always going to be the same one for the patient coming through. Is that right?
What do you mean? The cashier.
And I don't and I might be confusing you with someone else. So if I am, please let me know. But I recall something in the conversation that we had in which the first person that they speak with, this first concierge that they speak with for help, that's their person. They don't have to go anywhere else to
If they
find any other type of help.
if they want to, they can actually state, they can state, for example, "Oh, I wanna speak only with Adam." They could do that, and that will be
Mm.
on their notes. But obviously, because no, depending on the volume of calls, we have many
Oh,
people.
got it. Got it.
So we have a system though that will state exactly what happened during the last call, all the calls are recorded, etc. So you can do a very quick, follow up. It's another person is taking care of it.
Mm,
But they can request to speak with the same concierge person, and that has happened. And I say
mm.
Adam as an example. We do have somebody named Adam in the concierge, and he's great.
Very, very cool. I must have gotten it confused, but it's great to see the dynamic of how it works as well. Like no matter what topic or thing that they're trying to get solved for themselves, they will find help regardless. So that's really, really cool. And then I wanted to ask a question that I ask, I would say 99% of the people that have come on the podcast to you, which is this. Let's say you had a magic wand, Catherine, and you could just wave this phenomenal wand and solve one thing in the company to achieve all your client acquisition goals, all your revenue goals, whatever it might be. Even though there are often many priorities that as business owners, business leaders, we're trying to focus on. One thing, you wave that one thing gets solved, you can achieve your goals just like that.
Hmm. That
What do
is
you want to solve?
it's a very tricky question because I wish, first of all, there was one thing that we could fix to achieve all the goals, but
Yeah.
a lot of goals, I will answer it, but before I do, like, you got to keep in mind that a lot of the goals, they're attached to various things, right?
Of course.
It's not just one thing. There's so many aspects and subtleties that you have to make sure are connected in order for everything to move forward in the direction that you want.
Yeah.
But I would say that the most important one that would probably speed up a lot, it would be the software, like the
Yeah.
software I mentioned too about, like, in terms of a general kind of view, it's software needs, which we're already working on, but that
Mm.
takes time and effort, and it's not an easy change to do.
Interesting. And for the software, I just want to make sure I understand that as well. And for the listener too, do you mean that internally in the operations that are happening, or things like implementing AI systems, AI tools to look externally for the business and oops, and through my pen and growing revenue, etc. How does that? How are you thinking about that?
Um, it's just I think it's a combination of both.
Mm.
The combination of both, like, we have a good system right now, but it can definitely be improved. And in terms of basically reporting data as well, and have definitely more automations for sure.
Mm.
Definitely
Mm.
more automations are needed, and I think AI can definitely help with that.
Very, very cool. Do you think there's a like a hardest part of growing the business? Because I think healthcare is such a different industry to so many other industries where things can be a little bit in healthcare, things can be a little bit less simple. I don't know if that's the right way of putting it.
Yeah.
Um, do you think there's like a part that's like, oh, this is the hardest thing when it comes for us when it looks when looking at the business growth and what we're trying to achieve?
It's changes because in
Mm,
healthcare, there are changes every year. Um, you also another thing I think that is a really good advantage to what we do is that we don't have to be tied to open enrollment. Our
really?
plans, they can be purchased outside of open enrollment, so any time of the year, which is good. But when you are in this industry, there's a lot of changes. There's changes in guidelines for different products too that also happens every year. There are changes in pricing, and you have to be ahead of the game to communicate
Mm,
to the customer, make sure they understand how they're gonna be impacted, but also changes in regulation too, because it is, a lot of the states have different regulations for it. So that's another compliance type of situation that we have to be on
yeah.
and just overall, federal regulations. So
Hmm.
I would say that's probably the hardest part.
So really needing to be adaptable to all types of these different situations. Is that right?
To be adaptable. You have to.
Mm. So, Catherine, thank you so much for your time. This has been such
You're
an incredible conversation.
welcome.
Where should people go if they want to learn a little bit more about you, or, of course, a little bit more about MPB?
Yeah, so, they could go visit our website, which is www.mpb.health, and by the way, MPB stands for Mental Physical Balance. That's what we're all about. And then myself, they can find me on LinkedIn as Catherine Okubo or on Instagram, cat.okubo.
Amazing. I will, of course, leave everything down below here if you are watching and you want to check that out. And if you're still listening to this conversation, you enjoyed it, and you want to hear more conversations like this, please subscribe, and I will see you on the next episode. Thank you so much for your time, Catherine.
Thank you.